Genetic testing is becoming popular to trace one's ancestry. But now these tests can reveal what foods are best for you, advise what medications might not be effective, and alert you to diseases to which you may be susceptible. Dr. John Abraham discusses how DNA testing can help you make better choices for your fitness and nutrition.
DNA in medicine has a vast impact. We are virtually 99% the same from person to person. We do have a 1% variation that makes us all uniquely different. Everything from hair color, skin color, to rates of obesity. There are genes that tell us if we're more likely to be overweight. There are genes that tell us if we're going to have a higher metabolic rate. Genes that will tell us if we're going to be able to tolerate medications better than the next person. Some people will have side effects to medications, even within one class. You take, for example, the statins. You've got many of them out there, Crestor, Lipitor, Zocor, etc. A person may react badly to one versus the other one. If you know their genetics and how their genes and their body is going to process the medication, you're able to decide which one is going to work best for them.
Your likelihood of being obese or being able to lose weight is linked to genetics.
We find people that go on the same diet together. One person loses weight, the other person gains weight. When we have that issue, what are they doing wrong? And that's where that 1% diversity of genetics comes into play. Personalized medicine and personalized approach to DNA takes a role. We're able to have an owner's manual for our health and decide, you know what, I need to do more cardio, or I need to do more strength training. I need to watch the fats in my diet, or I need to watch the carbohydrates in my diet.
These tests help people make informed decisions about lifestyle and prevention.
The way we've been performing medicine in the U.S. has been very reactive. We wait for somebody to develop heart disease, wait for somebody to develop a cancer, wait for them to have an adverse reaction to a medication. But instead, if we can be more proactive about it and determine what they're more prone to or how they should live their life to begin with, we can avoid a lot of those problems. If we're practicing our annual screening along with the routine cholesterol checks, blood sugar checks, we throw in the DNA concept and the genetic aspect, we start to be able to detect and plan for the future for these patients. It allows people to live a more educated lifestyle that is more precision-based as far as treating their life and their health from a personalized standpoint. I would truly say that every patient would benefit from genetic testing. We look again at the role of prevention versus treatment and reaction to a situation or a health issue. With our patient, for example, my patient population I primarily deal with is based at a nationwide trucking company in Springfield, Missouri called Prime Inc. So the majority of our patients are truck drivers. And unfortunately with truck drivers, we're dealing with about a 69% rate of obesity compared to the nationwide rates of about 30%. We deal with about twice the amount of diabetes. And obesity being a trigger for diabetes, we're able to help these drivers and these patients and others out there by assessing the need. Even if we're testing children for their genetics and their genetic profile, we can help them make decisions at an early age to prevent that early heart attack at age 30 or stop that childhood obesity that ends up creating problems for them later.
Dr. Abraham discusses how to get DNA testing done.
Patients are able to contact specific labs and order DNA tests, various labs as it will. Fortunately, in Springfield, we have a lab called Dynamic DNA, and they're able to send out kits. We process all our labs through them. And by way of that, we can assess the fitness and the nutrition. We can assess patients' ability to determine what medications are going to be best for them. People have all, for the last several years, been using DNA for ancestry and even artwork for that matter.
Your DNA test results can help you and your doctor tailor a diet and exercise plan.
Once patients have had the test done, they send off their kits, and it takes generally about 2 or 3 weeks to receive the results back. And usually it's in the form of an extensive report in very written layman's terms. For some people that's great and they're happy to do it on their own. Others would like to take it to their providers, their primary care physicians, have them go over the results with them, help them develop a plan. You could even see nutritionists, exercise counsels, and develop a proper exercise program for you or a nutrition program for you. The nice thing is not having to muddle through the guesswork and decide which fad diet is best for me. Am I going to do an Atkins? Am I going to do a paleo? I've got it laid out for me. So that does accelerate that instead of playing the guessing game, but it does take the work of the patient to put that plan into place. I personally have had my own genetic testing done as well. And it came back with surprising information. All this time I thought I had to maintain a low-fat diet. Turns out I would actually benefit from a higher level of polyunsaturated fats. Found out that that would be better for my weight loss, be better from a cardiovascular standpoint, especially given my own history, family history of having early cardiac disease. So by boosting those levels or increasing that intake, I can have a positive impact on my health.
Future discoveries in medicine can be implemented into your health plan.
The beauty of genetics is that your information does not change. We'll check cholesterol from month to month and we'll see changes, but genetics don't change. And the nice aspect of that is that we can, as science continues to develop the information on genetics and what genetics have and as far as an impact on our health and our wellness, we are able to take those genes that we've already had tested and apply that to the future data that comes out. With the onset and the development of genetic medicine and healthcare, we're able to identify issues going forward and hopefully lower our overall cost of healthcare throughout the U.S., lower our risk of morbidity and mortality by identifying problems before they even occur.